My name is Glenda Boutell. I'm a consultant nurse and I'm also an advanced clinical practitioner working for Kent and Medway Partnership Trust, a mental health trust covering Kent and Medway locality. So my career journey is probably fairly unconventional. When I first qualified back in 2001, the nursing sort of career trajectory was mostly around senior management if you wanted to go further in your career. And the advanced clinical practice role wasn't something that was available to people in mental health settings, particularly at that time. So I would say my journey hasn't been fairly straightforward. I started off working as a staff nurse, which is kind of the traditional path for many people just qualifying. And then I went through a time of thinking I'd like to do more, but work clinically, but those opportunities weren't available. So I continued to progress in my career and went into operational management roles, which wasn't a good fit for me, and I knew it wasn't something that I wanted to do, but again, those clinical career opportunities weren't available. So I did various modules that were kind of very clinical orientated. I qualified and became an approved mental health practitioner, and then I did my non-medical prescribing course after that. So these were things that were going to be tying me into a clinical role, but actually didn't have a name of what I would become at the end of that. And I think this organisation, probably back in 2018, started thinking about the advanced clinical practice role and thinking about actually how could we have those clinical career pathways within a mental health setting. So because I'd done all of those clinical modules in the past, I was actually in a good place to say, okay, I'm very clinically aligned, I've got all this kind of previous knowledge, and I actually am quite keen to continue in a clinical sort of avenue. I applied to go on the ACP Masters, and fortunately I was told because I had a previous Masters that I wouldn't have to do the whole course, so I went on an endorsed route. So for me, my journey, like I say, hasn't been fairly straightforward, but eventually got me to where I needed to be in terms of working clinically and having a clinical focus. So as a mental health trust, we would consider ourselves kind of secondary and tertiary service, but we do have a primary care mental health service working very closely with our GPs. One of the things that has been a big challenge for mental health, particularly in primary care, is the lack of those resources. So in GP surgeries, in the past we used to have community mental health nurses based in the GP surgery, and over the last decade or so we've seen kind of a move away into sort of community mental health services. We have a very small primary care mental health team within KMPT in Medway as well as in Maidstone. We work very closely with our GPs to make sure that we can support GPs to prevent people coming into secondary mental health services. So that would be around making sure people who are on long-term medications are reviewed alongside the GP, ensuring that we have regular sort of monitoring of people who have long-term mental health issues, and supporting GPs where we do have those assessments that would generally meet the threshold of going to secondary care, but we can avoid that because we have the primary care mental health service in place. I became an ACP because I think fundamentally for me, patient-facing role has been a passion of mine. I never wanted to go into senior management, and as I was saying before, this is one of the challenges I think in nursing, is that there aren't those kind of very clear clinical career pathways compared to the operational management pathway. I enjoy working with patients. I think the work can be stressful but so rewarding, and I can have a really busy day and come away from it feeling as though I've kind of had a good sort of day, good work satisfaction, because I know that there's good outcomes for patients. So being able to see that in a very live way is important for me, and that's why becoming an ACP is such a big part of making sure that I get the job satisfaction, but I also able to deliver sort of that patient-facing work that I enjoy doing. ACP role in mental health is pretty diverse. I think one of the things that for me is an important part of being an ACP is the level of autonomy. I work alongside a consultant colleague, and as I've progressed in my own clinical career pathway, my level of autonomy has increased, so less reliant on my senior medical colleagues for support, because I have the skill, the experience and the knowledge to manage patients independently. So my working day, for example, would include seeing patients who've just been admitted to the ward, starting to work out a treatment plan, putting that treatment plan in place, and then following that ongoing monitoring, working alongside the MDT to ensure that we're monitoring progress, but also if there's any changes to the treatment plan, I'm able to kind of implement those in a timely way. The other aspect of my role is making sure that if there are any additional investigations that need to take place, I'm able to do that. So requesting scans, blood tests, anything that will support that patient's recovery and improve mental health, I will do independently. So it's quite varied. So in terms of that patient focused contact, it's about those treatment plans, but my role also extends to working with other colleagues in the organisation and externally. So for example, we have patients that have alcohol issues or substance misuse issues. I'll be liaising with other organisations to make sure that that treatment plan isn't just focused on the treatment currently in hospital, but looks at the long-term recovery. So making sure that there's a wider holistic care plan in place. So I think there's so many different things that ACPs do, but fundamentally it's about making sure that patients have good outcomes and not just looking at the here and now, but looking widely at the kind of a biopsychosocial model. So I think one of the really big things about the ACP role is how diverse an ACP is. So if you look at other professional groups, doctors do doctory things, social workers do social workery things, and I think ACPs encompass so many different skills and are actually able to work with patients much more holistically. So I think for me the impact of having an ACP is having that someone that understands the different factors of what keeps people well. So if I give an example of some of the patients that I see, you know, I'm not just looking at their physical health, I'm not just looking at their mental health, I'm looking at their social care needs as well. Just a variety of things that we know keep people well. And my focus isn't on one aspect, it's on a multitude of things that are going on for that patient. So I think the impact for patients, and I can say that anecdotally as well as in terms of the feedback that I've had from patients directly, is that they feel that I have more time for them, I listen, and actually when they need changes made to their treatment, I'm just usually available, and there's a responsiveness about the ACP role. So I think the impact for patients is that availability, having someone who appears to understand, not just from one aspect, but from different aspects about what their needs are. So I think that's the biggest impact for patients. I think one of the other things about having an ACP workforce is that we know that resources within the NHS are stretched. You know, we know that there's issues for doctors, we know that there's issues for nurses and other professional groups. And actually traditional ways of working in terms of having that hierarchy, you need a doctor, you know, you need a junior doctor, you need a nurse. I think that's becoming quite dated, and we're realising that actually if you have someone that has the right skills, the knowledge and experience, why can't they carry out those roles? So in the same way that I think that GPs struggle, so in primary care we have ACPs working in GP surgeries because we know that they can deliver a sort of a good service. They're able to assess patients from a physical health point of view, from a mental health point of view, and actually make sure that people aren't waiting a long time for services. There is something for me about how diverse the ACP role is, but also just thinking about new ways of working. Moving forward, we need to have a diverse workforce, we need to have people that have the right skills, not necessarily we need to have certain professional groups. So I think that for me, widely, that's where the ACP role fits so well. I would definitely recommend that people think about advanced clinical practice if they want to look at a clinical career pathway. For me, the ACP role isn't the end of your clinical career progression. I think there's more. So you have consultant nurses, and within mental health you have approved clinicians. So there is a sort of a progression beyond ACP. I think for me, the ACP role as a starting point for that clinical career, I would say that people need to be clear early on in their career about what they want to do, and don't feel that because there aren't those opportunities around, you can't think about being an ACP. As part of your appraisal, as part of your supervision, talking to your line manager about actually what are your passions, what are your ambitions, and seeing whether you can build on that. You know, I was saying that my own career pathway wasn't straightforward, but because those opportunities weren't there. But that didn't stop me doing those modules and those courses that I felt aligned to the passion and the things that I wanted to do. So I think being clear about where your passion lies, what you want to do, and getting a manager to support you to do that is a way to kind of, you know, then be prepared for when those opportunities come up. Because I do think that if people want to have that clinical career pathway, they need to align themselves not just with their line managers but also with other colleagues, other professional groups like our junior doctors, working alongside those people, getting a chance to get a sense of what that would look like to deliver some of those things. But I would definitely recommend the advanced practice route. So I think for me, my journey hasn't completed. So I'm in a consultant nurse role, having done the ACP role, and my next step really, thinking about in the next 5 years, I'd like to work to becoming a clinical director. That's unheard of for nurses, but actually for me the ACP pathway allows you to start thinking that way, because this is about a senior clinical role, and you can only be in a senior clinical role if you've worked clinically throughout your career. I think for me, being a mental health nurse particularly, one of the areas that is a gap for us is around our physical health knowledge. So for me, it's building and finding those modules that align to making sure that whilst I'm giving someone support for their mental health, my physical health knowledge is as up to date, so that there is that parity across the whole system. So it's not just about mental health, it is about physical health as well. So I think that learning for me isn't something that stops overnight because you're an ACP or a consultant nurse. It's something that I have a desire for, and I would encourage people to think about that. So next steps would definitely be around what it takes to be a clinical director and working towards that.